Thank you so much for coming. We decided we hadn't really reviewed our healthcare plan in a long time. And in our little bit of research, we realized that there was a lot of opportunities that we could be providing to our employees and to our stores that saves everyone money. And the 5G team worked really hard on some options for us, and we're really excited to launch this new plan. It has a lot of incentives and benefits. And so with that, I'm going to hand it off to Tony.
Yeah. So Tony Gable with 5G Benefits. We have a few locations throughout Wisconsin. I also have Cassie Bornick here with me from 5G Benefits, and then our enroller, head enroller, Adam Zahn, as well, is going to talk through his Colonial benefits that they'll be doing as well. So we've got a couple sheets for everyone to look at. There's a one-page sheet that this is overview of all the benefits on a nice one-page sheet for you to see. And then there's also this packet. We call this the benefits guide. This is a little bit more detailed into more details on the benefits, and this is both of these are available. We've got what we call a 5G video vault. So this recorded video will be on there, and so is a hyperlink for you to download this as well to see it. There's a link on here. It's vimeopro.com/5gbenefits/Markquart, and you can watch that. And maybe a spouse was not here, a significant other, they can watch that. There's also videos on there on HSA basics, advanced HSA strategies. There's a compliance video with all the compliance notices we're supposed to be giving to you, that you have access to those on that website. But that's basically your kind of hub for watching the videos on the benefits. So the first and foremost, our renewal date is April 1st. So I think we started meeting with Markquart back in November. So we've been quoting, looking at options for quite a long time. Found some options that were a really good fit that we feel for all the employees. And that renewal date that we're going to be making all the changes is April 1st. So everything I discuss is going to be changing on April 1st. Okay, so when that renewal date happens, that is your open enrollment. So if you do not elect on April 1st, you have to wait until next April 1st to make a change. So if you say, oh, I don't want health insurance this year, maybe I want it in July, I'm going to go without it or whatever. You can't do that unless you have what's called a qualifying event. So maybe you lost coverage, had a baby, divorced, married, one of those items, then you could come on the first of the month following whenever that happened. Otherwise, you'd have to wait till next April 1st. Okay, so April 1st is the date for our open enrollment. That's when the rates change. That's when all the coverages are in effect. So any claim that you have between now and April 1st is under your current insurance cards, current network, current insurance cards. So keep doing as what you're doing. The day of April 1st, even if you don't have your ID card, so we'll talk through the process of that a little bit, because we want to make sure we do this the right way. We have our enrollers that are going to come meet with the employees to get you educated and signed up. So that process, this is an extensive process for us to make sure that we're doing this the right way, right? So as part of that, ID cards take about 2 weeks from the time that we submit everything to the carrier. So sometime it's going to be close for April 1st. So the one thing that I say for your ID cards and for just in general of care over the next month is if you do have anything like prescriptions is always the biggest question that we get. They say I've got prescriptions that I have to have filled. Fill those the end of March. If you're eligible to get those filled, fill them the end of March under the current insurance company, so you at least have that first week or 2 weeks of a really important medication that you need. We never want to be on April 1st and someone's trying to fill at the pharmacy and they can't get access to it because they're not loaded in the system for whatever reason. Now it's won't be a Markquart thing, not a 5G benefits thing. That's just when you switch carriers, it takes some time to get into the new system. Okay, so what we say with that is fill those prescriptions that you need at the end of March here. Maybe if there's even a visit you've got scheduled that you could push back a week. It always just helps. Sometimes you can't, but try to do that maybe if you could, because we are switching on April 1st. So as part of that, any claim that you had before April 1st does go to that old carrier. So what happens is there's going to be a little bit of timing from claims that went to them, and then they're going to have to get it over to the new one. So just those claims, it takes a little bit of time, but the first month or two is learning how this all going to work, but it will get through. The last piece is deductible credits as part of that. Oh, can you see? Yeah. So last piece is deductible credits on that. Is if anyone hit any of their deductible with the old carrier, you will get deductible credit to the new one. so maybe you hit $500 or something. The one thing I say with that as well is that report doesn't get pulled until about 3 to 4 weeks after we switch. Reason being is, let's say we had 10 employees that went on March 31st. That if we pulled that right away, it wouldn't show up because the claims wouldn't have been processed, right? So it's always standard practice to wait a few weeks, pull the report, and then the new carrier takes 3 or 4 weeks to process it. Okay, so if you did go in and the new carrier, our new carrier that I'll talk through, Self Fund Health, shows that, hey, you didn't hit any of your ducks, you're starting over from scratch. Don't worry, if you hit it previously, it's going to get credited. It can take up to 2 months for that sometimes, and for whatever reason, if you have to pay it again, they will cut you a check back. So nobody's going to be left out. You'll be made whole. So those are kind of the couple caveats here over the next month to keep in mind. Okay, so let's talk through some of the benefits. This sheet, the first page, just kind of went over the waiting period, first of the month following 30 days, that eligibility that I talked about for if you waive. If you don't have, does everyone have a packet of one of these, or at least the majority? If you don't have a physical one of these, this is available on that Video Vault link that you can download as well. Okay. Some of the contact reference sheets. This is a good overview of all the players that are involved. So the first one, you'll see Self Fund Health. That was your old BPA. So Self Fund Health inventory. What was it? Yeah, your new one is your new one, Self Fund Health. Your old one was BPA. So that is correlating from your old one to this is the new one. You used to also have CVS. That's now Capital RX. That's your pharmacy benefit manager. And then your old network used to be Health EOS. So depending on where you live and which location you're in, we're using a combination of a few different networks. And the reason we're doing all these changes is a number of reasons. Like you'll see it says Alliance and Trilogy here, or First Health. So Alliance, what we did was we actually did a provider disruption report as well as a provider discount report. So we ran the numbers to see if Markquart Automotive was with the Alliance as the network, what would you have paid with discounts? What would you have gotten for discounts? And the discounts with the Alliance would have been like 21% off of the full retail rates, whereas Health EOS, it was only like 5%. So it was significant difference, and that means that's a big difference to you. It's a big difference to Markquart. So we actually, just for the same providers, if you walked in with the Alliance network versus you walked in with Health EOS, you're going to pay a lower price, like just pure off the top. So that was a big reason. Now, a question is, again, as part of that is, and this is probably a big question, is where can I go for care, right? So that was the big thing that we wanted to stress, is that we didn't want people to have disruption and lose their doctors. So the Alliance they're actually a cooperative of companies in Wisconsin, so they're a Wisconsin-based network. They have all of the big players locally here. They're going to have the Oakleafs and the Mayos. Mayo would be through the Trilogy partnership that they have. They're going to have Oakleaf. They're going to have Sacred Heart. They're going to have all the big ones that you're going to want locally here. Down towards Madison as well. They're big down in the Madison and big in the Valley area. And then people that are in the Minnesota area, they have First Health. So you can use Mayo, and then they also use the First Health network that allows you. So just know that based on where you live, if you have questions on which one applies to me, if you're Minnesota, it's First Health. If you're really anywhere else, it's going to be the Alliance with the Trilogy partnership. Okay, so and it just, what they're trying to do is make sure that you have the right access to doctors, right? So where do I search? Where would you search for providers? You can search right on that website link. It shows the alliance.org. You can search on them. And then if you're in the Minnesota location, you could search at firsthealth.com. Okay. So I'll go to the next one here. Okay. All right. So this is a slide on the medical insurance side of just the plan that we're going with. You will see the semi-monthly. We've got $125 a month for semi-monthly premium for employee only, and $300 for family. There also are the links here again for the Alliance Trilogy partnership, as well as First Health, and then we'll talk about direct primary care in a little bit. So this whole program of what we're trying to do differently. Okay, so the biggest thing that we were kind of stressing was transparency. We're trying to provide make sure that you guys know the full cost of healthcare. So healthcare in general, Wisconsin is one of the top 3 states in the country for the worst cost of healthcare. Like, we have some of the highest cost healthcare in the country, and that is detrimental to you and to really everybody. It's not a good thing. The other part about healthcare is if you pull out your health card, that's pretty much an unlimited. It's like an unlimited checkbook. It's an open check, right? So, when you combine those two things, it's almost impossible to keep the cost of healthcare down for a company like Markquart Auto if you have those two things combined. And third is if we don't have the proper education on where to find lower cost providers, you'll never pay less for the same type of quality care. So what we're trying to do is we're going to make that a lot different. We're going to actually partner you directly with lower cost providers, and we're also going to provide you the access to know how to do it. Okay, so this next slide that I'm going to just show real quick, and when I say access to know how to do it, is everyone here is going to get assigned, her name's Leslie Hobson. So she's actually right in with Self-Fund Health. She's tied directly into the carriers, directly into your health plan, where what she's going to do is what's called a real-time intercept. So anything dealing with where can I go for care, where's the lower cost prescription that I can utilize. Leslie is there for really anything that you need related to your health plan. So I want to give an example of something that she can do. She can do what's called a real-time intercept. So my wife actually needed an ultrasound. It was like a month ago. She needed an ultrasound, and she went to her normal doctor. And if we were on this plan, like my company, we have 25 employees. This is more of a fully self-funded plan. So we're not on this particular one. But if we were, Leslie would have automatically seen that there was an order for an ultrasound for my wife. She would have been able to do what's called a real-time intercept to say, hey, Kara, I saw that your doctor just ordered an ultrasound. You can have it at your current hospital. It looked like they ordered it at the current hospital. You can do that. It looks like that's going to cost about $2,000 for that. Or we can refer you over to this other one. It's going to be $200. Okay, and as part of that, we built in incentives where if you take the direction of Leslie and the team at Self-Fund Health, they're actually going to incentivize you to do that. So it could be $50 up to $500 that you can get for taking the direction of Leslie and the Self-Fund Health team. So our whole point is that's just one scenario. Now extrapolate that with 125 people on the plan through everyday interactions that you guys have with doctors every day. Because this diagram right here shows kind of two different paths, and it's hard to see, but on the left side there's an old gravel road that's been driven forever. It's the same way everyone's been doing it. They go to the hospitals for care. They have their primary care doctor in the hospital system that refers them to someone else in the same hospital system that refers them to someone else in the same hospital system. They won't let you leave the hospital system. There's a reason that happens. It's because everything is billed there. Hospitals actually, they have so many beds, they actually can end up legally billing more for Medicare and all other services if they're part of a hospital system. So what's different is we break that off. So you'll see some of these as go the right route is you've got, and on the right side you have oncology and surgical standalone surgical procedures, bundled surgery centers. So this is places that are here. Like Oakleaf's got an ambulatory surgery center that's less expensive than a hospital system, just because it's not built in the same facility. So that's a perfect scenario of us being able to steer you to a different direction versus going the same route. Now, when I brought up the Alliance and the Trilogy and First Health, you could go to that website and see your provider, and if they're in network, you can go to them, and nobody's going to say different to you. You can do the direction that you want. But we're going to, like I said, we're going to have incentives built in for you to try to go to that right side. Try to go to standalone clinics instead of just going to the hospitals. These are high-quality doctors that they're just practicing at an independent basis versus maybe at a big hospital system. Okay, so it's going to be a mindset change that we're going to have, over the next, 1 to 3 years as we start doing this over a 3-year period. You're going to be amazed at what you're going to learn over the next few years on healthcare and how things are billed and how things are delivered. You're going to see that. So on this bottom here, and I'll talk just high level because you said you want me to break it out individually on which one applies to which, briefly. Okay. So what these bottom ones are and in general is you can, like I said, you can keep your doctor, but what we do have in place is if you use it's called DPC, the direct primary care clinic that we partnered with in each location. Like, so for example, this location, we're partnering with what's called Pivotal Health. Okay, so in Minnesota, there's Nice Healthcare in Wausau, Anovia Healthcare, and in Lake Geneva, it's called the doctor's office. So basically what they are is if you use those clinics, no cost for all of the care that they have through there. Nothing gets billed through the insurance. Nothing gets paid for by Markquart Automotive. The reason we have is we're paying a per employee per month to have those all basically billed outside of the insurance. So it's saving you money, it's saving them money. And what they do, so like Pivotal Health, for example, what they do is they do anything primary care, urgent care, and they will actually, if you're in their service area, they'll drive to your house. So that one will drive to your house. So, now some Inovia and the doctor's office, those are physical locations, but Nice Healthcare and Pivotal are a little bit different where they'll actually go to your house. So I actually have access to Pivotal with my family. I've had them at my house 3 or 4 times now. We did all of our flu shots covered at my house for I have 3 kids and a wife. We had all of our flu shots. I established it as my primary care, so they've prescribed my personal medications, and then my wife my youngest son had an ear infection, and we ended up getting amoxicillin prescribed. Nothing got billed. You know, it was built in through how we built our health plan out. Okay, so questions on that so far? Main thing is we're going to try to give you access, and these direct primary care clinics are in the same mindset that, hey, why would we refer you to let's refer you to the lowest cost, highest quality place, not just keep somebody in the same system forever. Like they're agnostic. Pivotal Health doesn't own a hospital. They don't get paid by referring somebody to another hospital.
Are there any questions about that? Yeah, Casey?
I have a real quick one. On the Pivotal Health option, is that only mobile? Like, do they only come to your house?
So they are only mobile.
Yep.
We got this answer. So for example, their service area, which we can watch this on the video too, but their service area only covers Chippewa County, Dunn County, and Eau Claire County. So people who live in Durand, for example, at Dick's RV, they won't be able to go to their house if they live in Durand, but they can either go to a friend's house or go to a Markquart location, and they can be serviced here or at the Lubin Wash. Or so if you have a hurt wrist and you want a doctor, you can just have them come right to your work, and they can come at lunch.
Yep.
Okay, so Pepin County is not currently in their service area, but I think Dawn is probably closer for Dick's RV than it would be to drive to Eau Claire. It's not perfect, but I mean, it's still an option. The hospitals in Eau Claire is still farther away. So.
Yeah.
But yeah, does that answer your question?
Yep. Think of it like an on-site clinic. Well, they'll be here, and then if you are in the service area, they'll come to their house. Don't think of it's a negative, like, oh, they won't come to my house. Actually, it's more of like they're here, and then if you're in the area, they'll come to your house. You know, because they'll see you here, so everyone has access to that.
And it's same day, next day.
It's
right?
For sure it's going to be next days. A lot of times it's same day. They have an app, so if you download the Pivotal Health app right now, they're not live until after April 1st in this area. But I pulled up my app. It was a couple weeks ago. We had a visit. Pulled it up. It was at like 10 o'clock. I saw them at 2 o'clock, like the same day. It's real time. They'll tell you, when they'll be there. You pick the time, and they show up.
Did you have a question? On Pivotal Health, did they give us the provider report that they researched on what providers are doing?
On the app, it looked like it did, but confirm that?
They probably won't right away because, and it depends on what it is. So like if it's like a ear infection, it's not going to be kind of like I don't know how hard it is to get to your regular doctor for an ear infection. A lot of times they're going to schedule you out for a couple weeks for something like that. Like so it's not going to be, if it's like establishing as a primary, like I established as a primary, it's the same person every time. So you can reach out to see who is actually the person you're established with. Once again, like the acute care stuff, that's not going to be possible to have the same person every time.
To get that.
Yeah, that's it. Yeah, it would. That one you'd have to schedule out a little bit.
Pivotal is new to the area. They're obviously coming because of the situation that's currently arising in Eau Claire. So they'll be here April 1st, but they've been they're in Appleton and Madison servicing for a long time.
Yep.
The family was all aware of them too, so they're pretty well known for their services. But yeah, providers are probably going to change a lot after the closures that happen in March.
Yep. So what can they do? Visits, like I said, ear infections, lab work. So 90% of lab work, Pivotal can do. I had a client that she had a lot of headaches going on, and she could not figure out what was going on. She ordered a ton of lab work. She had a quote for, it was like $2,200 she was going to do at the hospital system, and Pivotal is part of that. They're in the same type of program here. It was a Fond du Lac based company that we work with. She paid nothing by using Pivotal, and she didn't even like talking about real intercept. Like when my wife did that order, I intercept with that, right? And in this case, I intercept. You guys actually have somebody, Leslie's advocating directly for you to real time. She can see it. Like, so she'll proactively reach out to you. Yep. Yes. Yep.
So right now it's
type
just the 3 for sure. We know that.
Yeah.
Dutton, Eau Claire, and Chippewa. So they'll go all the way to Willie's, obviously, and a little bit beyond. But Pepin and Trempealeau, there's a lot of employees that work or live there. So.
Well, let's just put it this way: the more people in this area that start to utilize Pivotal, and the more times you utilize Pivotal over another hospital system, the broader reach they can get. I mean, that's just reality, because right now they're building it up, right? And in Madison, they're huge in Madison, and they've got 15 people running there, and then once you start getting more people, more usage, you can do that.
Yeah, well, for example, I've been a male forever, and so what if I had to do an emergency room, or I thought, it's Friday night at 8 o'clock, and I really need to go to urgent care, because I know urgent care. Where do you go? What do you do?
Well, you can still use your health systems. That's not eliminated from this plan. But in terms of Pivotal, they do have urgent services. I don't know what the time frames were. They do have a website.
They're gonna get to, it's like 8 to 8, isn't it? Yeah.
Oh yeah.
Now keep in mind though, they're just launching in this area, so the hours they're going to continue to expand. But in Madison, they're 8 to 8 Monday through Friday, and 10 a.m. to 7 on Saturday and Sunday. So perfect example is,
which most urgent cares aren't.
I've had 3 instances with my family in the last year that we could have easily gone to the ER. Like they're not like life and death, but what else is open on a Friday night at 6, right? And Pivotal, we've used Pivotal 2 of those, and the other one we ended up waiting. It was not that big of a deal, but we ended up. You can do a lot of times. We waited till they were open. But the other thing is Pivotal does have the telemedicine too. So if it is something, who else can help me out with this situation? You're up north or something, you're on vacation, and you got, pink eye or whatever it is, and you need the medicine. Try Pivotal first, and if it doesn't work, then go to where you normally do. And it's, once again, you're going to pay nothing.
Is that just a phone call?
They can do a phone call.
Okay,
Yep.
So we've had that offered before. Is everyone familiar with that? If it's certain list of services, you can just call and they can prescribe medicine right over the phone.
Now, depending on which one you have, so like most of the employees are going to have Pivotal. And if you're in this area, like even if you say, hey, Wausau is Innovia, but you want to, Pivotal is in network with the Alliance too. So Pivotal at least is going to be, any employee can really use Pivotal if you're going to use them here. They're not going to have an issue with that. Yeah. Good.
Do you have a question, Katie?
Yeah, I was just wondering, so if you do this and you want to come to the service, but it would be more
You can even be seen at a friend's house.
Yeah.
So, so if you know somebody who lives, you're at a friend's house and you have no rights,
Yeah. So one thing is part of, I always say, and I don't know after I talk through this, if you will consider this a negative. I don't think this is a negative. The plan design, what we're doing is previously you had what's called a copay plan. So you had I believe it was a $600 deductible, and then you would pay copays when you went to the doctor. Okay, so you would pay a set amount, insurance would pay the rest. How we're doing this differently is we're going to go with what's called an HSA qualified plan. So it's a $3,250 deductible. Once that deductible is met, 100% paid for by the insurance company, by Self-Fund Health. And now as part of this, what we're doing though is it's $1,000, right? 1,000 for single. Yeah. So this is where we're kind of changing that game. Is we're saying we're going to go with a 3250, and once you hit it, you're done. Okay. But we're going to give you $1,000 into a health savings account. If you don't use that money, it rolls over. It's your money. Once they give it to you, it's your money. If you don't use it, it rolls over year after year. So you go the whole year and you use Pivotal Health the entire year, and for your visits, for your lab work, and maybe you have a prescription or two, you could have a pretty good amount of that money left over at the end of the year. And if worst case scenario, you have a $50,000 surgery that you just couldn't, you worked with Leslie, they went to a certain facility to have that cost down, or you went wherever you wanted, $50,000 surgery, you are going to pay $3,250 minus the $1,000 they gave you, so $2,250. That's a really good plan. And once again, this is, who likes these types of plan are people that don't use the insurance and people that use it a lot, because your max, and if you don't use it, the money rolls over year after year. So you have an incentive to not use your $1,000, right? Plus we have an incentive built into the plan to take Leslie's advice and to take Self-Fund Health's advice to maybe steer from the left side to the right side on that map and use those other types of services to save you money and the company money. Okay, so health savings account in general, what's the difference between a health savings account I'll talk on the insurance side, and then I'll talk you also have the ability to set up what's called an HSA. Okay, so when you go to the doctor, previously, like I said, you pay a set copay. I think it was like $20 or $30. You pay that set copay, the insurance pays the rest. So whether you went to Oakleaf or whether you went to Mayo, you pay that set copay, whether, behind the scenes it was $200 or $600. Like there was no transparency. You have no idea what the cost of that visit was. With this is we want you to have transparency. The whole point of this is for you to know what things cost. We want you to know, we want Markquart to know, we want everyone to know. So when you go in, you're gonna pay the full discounted rate. So if that full rate was $300, it might get discounted down to $200. You'd pay the $200, it would go towards your deductible. Everything goes towards that deductible, but you have that $1,000 in that HSA to pay for it. So those first $1,000 is paid for basically by Markquart, right? Because they're given to you if you set up a health savings account. Then plus you have the incentives. So there are no copays. So same thing with prescriptions. Is you set up, the first thing you should do is go to a local bank. We also have an HSA option that we're using. And that you can set up the HSA, where basically once you set it up, you're going to give that account information over to the team at Markquart Auto, and then we will get to work with Merit and Fidelity, that's who it's going to be with, to get you your account number and routing number. So think of the HSA like a checking account. It's your money. It's going into your checking account, but it's called a health savings account, meaning that it's designated for qualified medical expenses. So to use it for medical bills, prescription bills, you can use it for dental and vision bills. And if you use it, it's tax-free. So that full $1,000 is given to you completely tax-free. So let's say you made $35,000 a year, they're giving you $1,000, you're still only taxed on $35,000. Now let's say you say, hey, I believe in this HSA, I want to put some of my own money into this thing. How can I do that? You can put in a total in a calendar year of $4,150. So Markquart Auto is giving you $1,000. That means you as a single can put in $3,150 this year. If you're on as a family, you can put in $8,300. And the kicker with this is if you're on a family, so family is employee spouse, employee kids, or full family, you're going to get $2,000 into your HSA. So double, because your deductibles are double. Okay, so they're going to give you two. So if you're sitting here saying, hey, I make $35,000, I get the $1,000 from Markquart. I also, I want to put $1,000 of my own money in there. Okay, you're then only taxed on $34,000 of income, and that money goes right into your HSA. So it's pre-state, pre-federal, pre-FICA. It's pre-everything coming out of your check. So it's a huge tax deduction for all the employees. And once again, if you don't use it, it rolls over year after year. It's your money. Okay, so that HSA is going to be available. April 1st is when you can start contributing to that. So I do want to go back to this slide too. Is I was talking about the single, the $3,250 for a single. Family is twice that, so it's $6,500. Once again, family is employee spouse, employee child, or full family is just 2 deductibles. Okay? The nice thing about this plan, though, is let's say you had back to that $50,000 surgery. It was a husband and wife, and you had a $50,000 surgery. You did, and your spouse didn't have anything. They had a $50,000 surgery, and your spouse didn't have anything. You're only going to hit the $3,250, and then you're covered 100%. Your spouse, you don't have to hit the full $6,500 for one person on the family. So the flip side is, let's say you have 6 people in your family, and you all have $1,100 of claims. You would have hit the $6,500. That means you're all done with your deductible, and then all of you hit your deductible. You're all covered 100% by the insurance company. Okay. So 2 scenarios there of getting to that. Last thing on this slide that I want to go over is this prescriptions. So how prescriptions work is you're going to go to the pharmacy, and we use CareRx. So you're not going to you're going to get your insurance card, and you'll put it basically through Capital RX. I'm sorry, and how those work is you're going to be very transparent on the price of those prescriptions. So you could have the same exact prescription filled at Walgreens versus CVS, and the price could be completely different. Okay, so the biggest thing with prescriptions is we want to find where is the lowest cost for you to find it to fill that. So if you have some larger prescriptions or just prescriptions in general, after that first month and that first month, let's have you look around at a couple pharmacies. Maybe it saves you 50% to go from to change pharmacies. There's also mail order available, and then the other piece is Capital RX will work with you, and Leslie will work with you to also try to source those meds, because that bottom one that it says down here is Tier 4 specialty meds. You'll see that it says not covered for Tier 4 specialty meds. Okay, so the reason we put that in there, and why specialty meds are like that, we have what's called a soft exclusion. Okay, so if your health plan excludes specialty meds, that automatically opens up the door for employees to qualify for manufacturer's assistance programs. They call it MAP, manufacturer's assistance programs, or international sourcing programs. Okay, so perfect example is I was just working with an employee that was taking Keppra, and Keppra is a pretty expensive drug, and Keppra is actually manufactured overseas. So in his situation, they are actually going to ship it directly from Australia to the employee instead of having him go to the local pharmacy and paying for it. So he was paying like $1,000 a month for this med. If he uses the International Assistance Program, he's going to pay nothing for that. So what they're going to do is, and having the international sourcing and the manufacturer assistance programs triggers and allows for the carriers to basically work with you to have those covered 100% by the manufacturers or sourcing. So if your health plan doesn't say that it's excluded, a lot of times you're not going to qualify for some of those programs that are going to drive that cost down. So it makes so much sense for them to work with you, have you work with Leslie and Self Fund Health to try to find a lower place for you to fill that prescription, that it makes sense for them to just have it covered 100% by you or for you. So I've seen $20,000 a month med. My mom had cancer. She was on a $20,000 a month medication. She was taking a chemo pill. And with her, she was a school district teacher, and she was actually, it's ironically, was almost on an identical plan as that you had. It was like a $500 copay plan. She was doing all of her specialist visits. She was on like 10 medicines. She was on one of those $20,000 a month meds. And you look at, oh, I've got a great plan. I got a $500 deductible plan. At the end of the day, her out of pocket, she spent like $5,000 a year on the out of pocket, and then the copays didn't track towards her out of pocket. So she was spending like $700 a month on copays above her out of pocket. So on this plan, if she was on this plan, she would have paid her $3,250 and then been done. That $20,000 a month med, the school district was paying it. They were paying $20,000 a month because it wasn't excluded. In that situation, I worked with another employee in that exact same prescription that my mom was on. We got it sourced for no cost to the employee. $20,000 a month the employer would have been paying for that med, or through the insurance to the employers, the stop loss and insurance. So there's a lot of benefits to what we're doing on this plan, and the whole point is to try to have you know what things cost and how can we work together to keep the cost down, right? And it's not coming in here saying you need to do different what you're doing. No, if you don't want to do different than what you're doing now, you still want to go to the same providers, nobody's saying you can't, right? And what we want to do is provide the incentives for you guys to do something different, right? So here's a little bit about that HSA slide. This one that we've got it's got a banking side and then it's got an invested side. Okay, so like I've had my HSA account open, and once again, think of the HSA as a banking, like a checking account. Okay, so it's your account, it's your money, you put it in there, it rolls over, it's your money. You can put in $500 on the banking side and the rest on the invested side, and invested side, just let it run. And, and put that in how conservative or aggressive that you want to get on that money, you can do that. You can put it in bonds, really stable bonds. You can put it in the stock market. You can put it as aggressive as you want. The banking side at local banks, this is why we're kind of using this one, is like we had another auto dealership that had all of their employees with one bank. They were earning 0.01% on their HSA money. And we switched all the employees to this one. And the banking side was at like 3.5%. Like just straight banking money market, like they were able to get 3.5%. So it's a really good investment side to actually save that money. And if a couple things on the HSA in general is, let's say you put all this money in there, you're a young person, you've got all this money in there and you never have claims. It could happen, right? You don't have claims or you don't use the money in your HSA and it just continues to grow and grow. That's the whole point of what we want. We want you to have those continue to grow. When you turn 65, you can take that money out and use it for whatever you want. Think of it like a secondary 401k. You can take it out at 65 and have no penalty, use it for whatever you want. Okay? If you put the money in today, well, let's say you put the money on April 1st and you want to use it on April 2nd, you can use it right away and pay no taxes on that money. You can use it instantly, whereas obviously a 401k, you got to wait till you're 59.5. So this is some details. We'll get the enrollment form over to the employees for you to sign up. We want to make sure we get that because that $1,000 or $2,000 is there for the taking. There's that enrollment form that people can download as well. Flexible spending account, the full flex. Yeah. So this is really only going to be if you're not on the health plan, because you can't have a full flexible spending account and an HSA account. You can have a health savings account and a dependent care, so you can do it for dependent care still if you want to use it for dependent care. But you can't have an HSA and a full FSA. So you're sitting there saying, hey, I want to still do my FSA. I haven't taken Markquart's FSA. I still want to do that. You can do that. But if you're not on the health insurance, you can't get the HSA. Okay, so you have to be on a qualified health insurance plan in this plan. So one question I'm sure people might be thinking is, oh, I'm on my spouse's plan and theirs is an HSA plan. Do I get that $1,000? No, they actually legally cannot give it to you. It's only people on their health insurance plan that they can give it to contribute to your HSA on a tax-free basis. Okay, so the FSAs are still in play as well. Okay. Questions on that so far? I went over a lot of stuff there. Yep. It's one time, so we're going to load it this year. Hopefully everything goes well. We'll see how it looks like, but plan on it this year, and we'll see where the program works. I mean, the more money we save on the health insurance, the more money we can do benefits like that, right? So
that is Markquart opting to do that.
Yep.
Also, if you're on the plan, which most of you in here, I assume, are already on the plan, that money is coming in right away. If new employees enroll, it is actually prorated throughout the year, so it's not $1,000 as soon as they enroll, because they could just leave after 30 days, right? So it's prorated throughout the year, but this initial launch is going in the account right away. So $1,000 if you're single, $2,000 if you're a family.
Yeah. So to clarify, new employees. So anyone because nobody's on anyone on the plan now. If you hire a new person that comes on.
So there might be a couple employees in here who actually don't qualify until May 1st.
So they would be on a month.
They would actually have to go to the prorated amount. It would come to $1,000 at the end of the year.
Yep.
And then, so this is for the 2024 plan. This is new. It's a big change. So obviously the plan can change yearly, but so far we're very happy with what it looks like.
All right. Yep. Great question. Great question. So this is what I really like about the HSA is every bill that you have goes towards the deductible and goes towards that $3,250. And once you hit the $3,250, that is your max out of pocket. So those are the same numbers. It's not like deductible $3,250 and then out of pocket's another $3,250. Nope. You hit $3,250, then you'll see all the claims are paid at 0%, or you have 0% after the deductible. So you would pay nothing after that. Now, a couple of those caveats is like, it says preventative care. So preventative care is covered 100% on anyone in network. So if you go to the Alliance website, or maybe you're in the Minnesota location and it's the First Health Network, anyone in network's covered 100% for preventative care. So annual physicals, mammograms, PSA tests, well baby checkups, immunizations at certain ages, colonoscopies. Now, one thing I want to say about preventative care is preventative care is 100% as long as it's coded as preventative care. Okay, so like I had a visit at my doctor. This is before this, a couple of years ago, and I went. It was a physical. I went for a physical. It was just not much more than that, and I ended up getting a bill in the mail for like $160. And I wasn't like mad at my insurance company. I didn't call my insurance company and say, "Why are you billing me $160 for my physical?" I actually called my doctor because my doctor didn't code it right. It was clear they did not code it right. Okay, so there's a couple points there. Is your insurance company can only pay whatever's coded from your doctor. So legally, they cannot change the code. Like my insurance, I couldn't call my insurance company up and say, "Hey, this was a physical. Can you change the code?" They can't. It's illegal for them to change a code. I had to call my doctor. I called them like, why did you code this as a physical? Why didn't you code this as a physical? They're like, "Oh, you're right. I see the notes now that it was coded. It should have been a physical. I'll reprocess that." So what does that mean? That means my doctor's office resent that claim, that code to my insurance company, and then my insurance company recognized it as preventative care and zeroed out the charges. And they basically paid the provider. Okay, so two things there is one, insurance companies can only pay claims as preventative that are coded as preventative care. Two, you basically need to check on that for yourself. Check with the provider and make sure that they're coding things as physicals, because your insurance company cannot code it unless it's a physical, right? Okay. All right. So any more on the medical? Feel free. If you got a question, maybe someone's got the same one. We're all here together. We'll stick around for a little bit, but feel free to ask away. A lot more great things going in. Dental. So this is the cream of the crop dental plan. This is the best of the best. It was almost a very similar price as what you had before, but what we were able to go to is Delta Dental. So they're actually headquartered out of Stevens Point. They're actually a nonprofit, so Wisconsin-based company. And you'll see here that there's on the left here it says Delta Dental PPO. It's tough to see on there, but then it says Delta Dental Premier is the middle column, and the right is out of network. So it's one dental plan. We don't have multiple dental plans. It's one dental plan. But like for example, I use a PPO dentist. And if you're wondering, well, how do I know if my dentist is PPO or Premier? If you called your dentist, they will know. Delta Dental has like 90% of dental plans in Wisconsin. Like they dominate Wisconsin. So your dentist knows Delta Dental, and they know if they're a PPO dentist, Premier, or not contracted. So one, you could call your dentist, or two, you could go to deltadentalwi.com and search it, and they'll pop up and say PPO or Premier. So like I use a PPO dentist. My wife uses a Premier dentist, okay? So I would get the left column. So I get an unlimited annual max. So I could, if I was on this plan, unlimited annual max. So if you need 2 crowns in the same year, before capped at 1,000, they're gonna pay the percentage up to whatever it is. Like if you need 2 or 3 crowns same year, you need a lot of stuff done, you probably give me a hug after this, because this is the best dental plan you can get. Okay, so this is unlimited annual max, calendar year deductible of $50. So it's once you hit the deductible, then it's done. So it's $50 for single or $150 for family. Cleanings are covered 100%. So cleanings, x-rays, fluoride treatments, sealants, sealant to age 19. So I get that some questions sometimes. To age 19, they're just for the kids. 100% on if they're PPO or Premier, and it's 90% on if it's an out-of-network dentist on cleanings. Really nice with Delta as well is the cleanings and all those preventative services do not count against your annual max. So if you are using a Premier dentist, it's $1,500 plus all those cleanings. So that's really good. Now basic services like fillings, extractions, simple extractions covered at 90% if it's PPO. Major services at 60% if it's like PPO. Okay, so you need a couple crowns, they'll cover 60% up to unlimited amount for PPO or up to $1,500 for Premier. The other really nice thing about Delta is this one has orthodontics coverage. It reloads, so it's fresh. Right now is a 4,000 lifetime orthodontics on the PPO, and that's for adult and children. So most orthodontic plans, even if you have it, only covers till age 19. This one to age 26 plus covers adults. So it doesn't have to be just braces. It could be Invisalign or retainer type ones. So if you're sitting there saying, hey, I'm 40, I want braces, go ahead. You know that you've got the coverage now to do it. Okay. And now that's for each person in your family. So if you have a family of 5, you get $4,000 per person. So that's a big benefit. Okay, and it's $1,500 for Premier and $1,000 for out of network for that. Okay, any questions on that? All right, I'll just keep moving because we got
It was like $1 more.
It was.
Within $1 more. If you guys were
We got a great deal. Great deal on that plan for you guys. Okay, so there's a flyer in there on how to find a provider. I kind of explain. We got a diagram showing about the difference between a PPO and Premier. I won't go over that today. But if you use a PPO, it's not only better coverage, also better discounts. The other thing is the vision. So Delta Dental. There you go. Yeah. The other thing is Delta Dental for the vision. They have a really good vision plan. It's actually contracted through the iMed network. So the main ones that are not in network, I always point this out, not in network are Sam's Club, Walmart, or Costco. Sam's Club, Walmart, Costco. They're not covered under the network benefit through that. Now, if you did go to out of network, you could get a reimbursement, but you'd have to like file a claim and then get reimbursed, and it's only like $35. So you're way better off trying to find someone in network because this is a 12-12-12, which means all the benefits you can use every 12 months. So a lot of times you can only get frames every 2 years. This one's every 12 months. So it's a really rich benefit. When you go online to search, so it's deltadentalwi.com, you can select Insight. That is the network that you guys have. Okay, so what is it? A regular exam is a $10 copay. Then the insurance picks up the rest. And then plastic lenses is a $10 copay for standard lenses. Insurance pays the rest. If you want like standard anti-reflective coatings, it might be a higher copay, but it still will do that. Lenses within the frame lenses. It also does show. Oh, it shows some of the anti-reflective on here as well. But contact lenses. So it's frame allowance or contact lenses. Okay, so it's $150 every year for frames or contacts. Okay, but you can do the exam and the lenses every year. Okay, so there's how to find vision providers in there as well. Now, a couple other benefits. This Unum long-term disability. So as part of the whole package, we're really we looked at everything. That's why it took us a little longer because we looked at a lot of things, pulling this thing all together. And we found when we compared the American Fidelity stuff, we realized that you have a lot of participation in long-term disability. There's a lot of people that are here that are on it, believe in it. We had so many people that we were able to get a group long-term disability policy through Unum. Okay, so some people are saving like 80%. Like it is a significant difference in price going to the Unum policy. Now, with that is before people could sign up for like $1,000, per month because it's expensive. So maybe you only sign up for $1,000 or $2,000 of your income. Whereas what this does is it does 60% of your income up to $7,000 a month. Okay, so let's say you made $50,000 a year. Was that $30,000 that you would get on claim? $2,500 a month is what you would get on claim. So what happens is it pays after 90 days. So it's basically one policy. It's a yes or no. It's not I'm going to meet and I'm going to do 2,000. It's a yes or no type thing. But it's a cream of the crop long-term disability plan too, because it pays after 90 days, 60% of your income up to $7,000 a month, and it pays all the way to Social Security normal retirement age, which is 67, age 67, depending on how old you are, somewhere around there, 65, 67. Now, let's say you're still working and you're already 65 or something, you're already collecting Social Security. It does make sense for you to still take it because there is still benefit for up to from like 16 to like 24 months benefit that you could still get on claim if you're still working full time. So it could still make sense for you to take it. You'd have to look at the price, what it looks like for you. But I ran a number on somebody that was making 60,000, something like that. I was a younger guy. He was like 33. It was like $5 a month for the benefit. Like it is depends on age, right? Because the younger you are, the least it is, or the less it is. But I mean, some people on American Fidelity were paying $200 a month, and it was for half the benefit. So this is going to be significant savings for the employees. One thing as part of this is if you had American Fidelity before, you're guaranteed to get this, and there's also no pre-existing. Okay, so don't have to worry about pre-existing if you had a policy before. Well, let's say you're thinking, hey, wow, these rates are a lot cheaper than what American Fidelity is. I want to take it. They're going to look back 3 months. So anything in the last 3 months, they're not going to cover that in the next 12 months. But after that, if you can claim on it after that, or anything new. So maybe you had in the last 3 months, 2 months ago you went in for a cancer scare or something. They're not going to cover it for the next 12 months. Then they would. But let's say you take out the policy and you fall out of a tree stand this fall or something, break your back. Well, that's going to be covered. That's totally different, right? So it still makes sense to jump on the policy, get through your pre-existing. If you've never taken long-term, get it, and make sure you got that coverage. Okay, so as part of the long-term, what you also would get is an employee assistance program. Okay, so this is basically there's a lot of companies that will pay for this as well, and this would be included for you as part of the package, where it covers 3 counseling visits in person at no charge for the employees. So if the employees, and I believe it's for dependents, so it's 3 visits for each person. So marriage issues, you call them up, or you've got depression issues personally, or maybe you have a child that's getting bullied at school, you want them to see a counselor a few times. There's a lot of things that are going on that this is completely confidential. You can call them. I don't get a report. Markquart Auto doesn't get a report at all. We don't have any idea who's using it. But basically what you do is you call them up and you tell them what's going on, and they'll connect you with a counselor for that situation. They'll give you like a list of 3 or 4. You pick who you want, call them up and schedule a time. So 3 in person, but then you also have unlimited phone consultation with their in-house counselors as well. And that's per person per year. Okay, so that's a very strong. So nothing with the health insurance would be billed. It's just, let's say you want more than 3 in person, well then you could use your health insurance and still see that person, but it would go towards your deductible. Okay. Travel assistance. This one as well is built in. For people that do that long-term disability, this is just like emergency medical evacuation, lost your passport. Like there's some travel assistance that you can utilize from this service. There's a reference number on there as well that you can see.
All right, we're going to go to the blue packet that I have here in the folder. We're going to go through these options one at a time, okay? And first one is the short-term disability product. I put in a little policyholder portal. Basically what you're going to do is you're going to register on the website, so if you do enroll in any of the Colonial Life benefits, this is a great way to access your claims and direct deposit. So I'm going to go over like wellness claims and like if you had an accident claim, things like that, that you're going to be able to access those monies very quickly in 24 hours or up to 3 days for those wellness claims. Okay. And touching base on that short-term disability product, the left-hand side there's going to be a flyer that gives the rate information. I'm going to go through that very briefly here with you. Okay. The long-term disability pays after 90 days with Unum. Okay. You do have a 3-month option available for the short-term disability. So what happens about those first 3 months that you'd be looking at? Okay. The first option that you'll see there, I'm going to go over the elimination period, which is more like a waiting period to you as an employee. Okay, you're going to see the 0-7, which is a 0-day accident, 7 days sickness, and a 0-day accident, 14 days sickness. Okay, what that means is you wait 0 days. So if an accident happens, say you're in a car accident, for example, and you get whiplash and you're off for a calendar day. Okay, if that's a Friday, or they don't know if you work weekends, it's 1 day that you'll be off. They're going to pay you a portion of that benefit for that day. Okay, up until that 90 days is satisfied. Okay, then your long-term disability, if you choose to elect that, would kick in. Okay, and what about a sickness? Okay, sickness would be like your wear and tear type of events. So such as like a wear and tear surgery, a pregnancy if you're planning kids, if you're a female, or anything as far as like say maybe a kidney stone or a heart surgery, things like that that are going to be more sickness related. Okay, you can wait a week or you can wait 2 weeks, and that's going to make a difference as far as what your premium would be. Okay. And unlike the disability for the long term, it's 60%, you are eligible for up to 60% of your disability earnings per month, okay, for up to that 3 months. So I gave examples of a $1,200, a $1,500, $1,800. You can actually go in $100 increments through that. I just wanted to give you some different examples as far as what it would pay for some of those age bracketings. And the nice thing about the disability is, just like American Fidelity, you will have the credit for time insured. So if you are currently on a short-term disability plan, they do credit for the time that you had it, okay? And when you're locked in at those rates, so say the 17 to 49, say we have somebody hovering around that 49 to 50 bracket, you're locked in at that 49's rate if you take it out at 49, okay? So that rate does not change for the life of the policy, okay, which is a great benefit to you as the employee. So you'll see those different age bracketings as you go. And again, that is a post-tax benefit, so nothing as far as your benefit is going to be taxed or you have to file for a W-2 income, okay? Which is a great thing because you're paying for it, okay? Next one. Any questions on that so far? I know I went through that pretty quickly. Oh, yes, also pre-existing. So, for example, this is the first year. All of your questions for short-term disability, so say you were just involved in a cancer case, or you might have a heart condition or something like that that might knock you out from coverage with American Fidelity. It is guaranteed issue this year only, okay, to get the coverage. If you are not on the coverage currently, there is a pre-existing clause. Tony gave you the 312. Same thing with the colonial disability for short term, but it's going to be 12-12. They go back 12 months, forward 12 months on that. Okay? Thank you, Cassie. All right. The next one is going to be the life insurance, and this is going to be a slight change from what you're used to. Okay? So the term life insurance product on the right-hand side, it's actually in the back, the very last brochure I'm going to go through with everybody here. Okay? So there's a couple different types of term and life insurance, okay? There's a group term life and a standard traditional term life. This is a traditional term life. And what I mean by that is group plans were in different brackets, and when you hit a different bracket, your rate would go up, okay? With this one, you're gonna have on the back of the brochure there's a 10, 15, 20, and a 30-year rate examples there. So how that works is, the best way I kind of describe this is like rent. You're paying the same amount for 10, 15, 20 or 30 years, okay? So that rate is stable. Nothing happens during that time, okay? That money's gone, but it's gonna continue at your new age rate versus where you're at your old age rate. So the 30-year term option goes away with 90% of companies at age 50. The reason being that they're gonna insure into their 80s and they're taking on that risk, right? So with these plans, anybody that is over the age of 50, there's no blood test or physicals required for life insurance coverage. Okay, if you are under the age of 50, it's going to be $250,000, no blood tests or physicals. Okay, so you don't have to go through that extra work for the plan itself. Okay, if you do go above that, you'll be subject to that physical. Okay, and they can do that on site. Pivotal Health is a great example of that, where they can do those exams on site. Okay, and as far as that goes, you can also do spouse coverage for the same rate examples all the way through on those. Okay. And the best part about this is there's different underwriting requirements. So one employee I had just this last week, he had congestive heart failure, okay? He's an employee that answering health questions for life insurance, pretty much anywhere he was knocked out, all right? Or giving him a crazy astronomical rate, all right? If you are under the age of 50, you can get a $49,000 life insurance policy. as long as you aren't hospitalized 20 hours or more in the hospital in the last 12 months. So I've had cases where this guy for congestive heart failure, he was in the hospital for, I think it was 18 hours, all right? He wasn't at 20 hours. He's satisfied for a life insurance, which he wasn't able to get before, okay? So there's great opportunities for you to take advantage of this for you and also your spouse, okay? Included in there is also term riders for kids, so you can choose dependents up to age 26 on that, okay? And then another factor that comes in is people always say, well, I hope I'm not working in 30 years, but if I were to leave or retire, I can take this plan with me at that same rate of my term, okay? The only time that rate changes is after the term expires, okay? Does that make sense to everybody here? Questions on that one? All right. Next one, the voluntary accident insurance. We do have quite a few people on the Fidelity that are on this plan, and this one's going to be a really advantageous difference from what you've had from Fidelity to Colonial. On the sheet there, I did give some rate examples on the underneath the disability rate examples there. There's a basic and a premier plan. People are going to ask me, what's the difference? It's the same plan, except the brochure, when you open that up on the inside, it gives you different rate examples as far as what the benefit is going to pay you directly for those accidental injuries. Okay, so this is like a checklist to you. So for example, if somebody were to have stitches, they're going to pay you for your initial benefit. Say maybe you have an x-ray, you're going to have a follow-up visit to get those sutures out. All right, it's going to hit different parts of this brochure on the checklist for that. Okay, and what you see is what you get. So you'll see Olivia's accident benefits that are included there. This is a bad car accident that she was in with a fracture, and it shows the different benefits that are available to help cover those out-of-pocket expenses you might have due to an accidental injury, which is a great plan, especially if you have kids involved in sports. Maybe you're a handy person around the home, or you don't prepare for those unexpected injuries. So it's something that's going to help cover that or help replace those HSA funds that you're obviously working to build up, okay? And included in these premiums, so before Fidelity had a wellness benefit that was in there, okay? How that worked is you had to go in and you had to show proof that you had that visit done. So that might be a pap or a mammogram for the ladies. It might be a PSA test, a colonoscopy, blood test for triglycerides, cholesterol, glucose, especially if you're diabetic. I know you might get those done every 6 months. It's a great way to get money back on your plan. And inside that brochure, there's the Wellness Being Assistance Max. Okay, so that lists all of your different exams that are covered underneath there. So like annual physicals, immunizations, and on the other examples I gave, that's $100 per person per calendar year. So if you look at the basic premium for a semi-monthly and the basic accident plan, you're looking at roughly, if you get this wellness benefit done every calendar year, you go in for a physical, you're basically getting your money back on your premium. Okay, so it's a very advantageous plan at a much lower cost. People are saving about, I think the rate's about half on the Premier plan from what you're paying now. The basic's gonna cut it down even more than that, okay? And your benefits always increase with time. So there's a building benefit. I threw in a couple extra flyers on that. The building benefit, it goes up with time. So every year that you have it, you hit those different thresholds, it goes up by 5%. Because right, medical costs haven't been going down. It's always usually been going up. So it's a great way to help stabilize your premium and then also your benefits to what the market's doing, okay? Go ahead, Cassie. And the last one that we're gonna go over the Colonial products is the cancer critical illness. All right, and again, quite a few people on these plans as well. With the critical illness, they separated it with American Fidelity. All right, if you chose cancer, you had to choose cancer. If you had the heart stuff, you had to choose the heart stuff separately. So you had to pay for 2 separate plans, okay? We simplified this into one. And what we meant by that is on the brochure there, you'll see there's coma, end-stage retinal failure, heart attack, stroke, bypass, paralysis, coma, invasive cancer, skin cancer diagnosis, you do see on there for a $400 lifetime. So melanoma is an invasive form of cancer, so that's gonna be in your category of the 100 percentile. What that means is you choose a benefit between $5,000 and $50,000 if you were diagnosed with any of these forms, okay? Your cancer plan before had to pay per treatment. This, you know what you're getting up front, okay? And once you're locked into that rate again. And what I mean by that is on the left-hand side there is your critical illness brochure rates are monthly on here, so you will have to divide those by 2 because it's a little bit more complex. When you choose this is off of a rate of $1,000 increment. So if you choose a $10,000 plan, you're going to multiply the premium by 10 and divide by 2. Okay? And you'll see also named insured and spouse, and then there's also dependent children and kids included. The kids are actually thrown in. If you look at the named insured and spouse versus the named insured spouse and dependent children, they're exactly the same rate. So kids are thrown in for 25% of what you choose, and the spouse is at 50%. And it will go off of the employee's age, okay? So when you're in these different brackets here, so let's just say we have somebody in the 45 to 49 bracket. Once you're in that bracket, you're locked in, and it's at that employee's rate. So if your spouse is older than you, you're using the employee's rate, okay? And the guaranteed issue amount on that, so for example, if you did get cut out from that before, or say due to health, this year only is up to a $35,000 benefit that you can choose, no questions asked. You can get the policy, okay? And with that, that's locked in for the length of the policy. With the wellness benefits attached, we're going into the last slide here. The accident was $100. Same thing on the critical illness, it's gonna be $50, okay? You do have both options, so say you do have the accident and you want the cancer critical illness, you're gonna get the 100 for the accident, and then you're also gonna get the 50 for the cancer critical illness plan, all right? The biggest difference with the critical illness plan is the $50 per person per calendar year for, again, any one test, and the only ones that are excluded on the critical illness is the annual physicals and the immunizations. All the other wellness benefits apply to that. I didn't want to throw in an extra brochure just for those 2 things, okay? But questions on that? Awesome, thank you. Oh, enrolling. Okay, as far as enrollments, I will be on site here at Toyota Wednesday, okay? We do have 2 other enrollers that are gonna be going to the other locations, okay? We're gonna start at open and work through them one at a time, all right? As far as enrolling the benefits, please have your dependent's age and social security number for the medical, the dental, and vision elections. We need that to be, and date of birth, okay? So we need that information when we're enrolling, otherwise we cannot get to the next screen. So we need to make sure that you have that for your beneficiaries and anybody that's electing the plans, okay? Correct. Yep, we're going to be enrolling through the system. The sheet is just a benefit menu or just as a guide to explain and show you what we're going to be going through one step at a time, okay? So once we take those elections, that's the final go, all right? And then we send it out to the carriers and to 5G, and we handle it from there. Okay? Perfect.
Really quick, if there is anybody who is currently on specialty medications, or if you have a severe health condition that requires a lot of visits and so forth, the nurse that Tony talked about, Leslie, we are going to be making available her calendar, okay? Because she really is your dedicated point of contact, and we want to give you the highest level of service. She can walk you through and assist you with all of these processes, especially the medications. That's something that, even though the plan doesn't go live until April 1st, getting out ahead of that and working with her to try to make it as smooth of a process as possible is going to be your best bet. So I will work with Amy to get Leslie's information.
It will be on the info desk for the Lube and Wash. Chris will have it.
Okay, so info desk or for Lube and Wash, Chris will have it if you didn't hear that in the back. And again, that's a direct access to her calendar, so then you can have that confidential conversation with her, again, to make sure we're getting out ahead.
Yep. And just the last things is just, you mentioned the specialty meds on doing that, but any meds in general, just to recap, make sure before April 1st here, if you could get a restock of what you got with the current one, just so you know you've got that ready to go into April. Pivotal Health, you can download the app. It's not going to be live, but feel free, just go to the App Store, download Pivotal Health, and you can start playing around with that, putting your information in, so it's ready to go on April if you want to use that. I think just in general, the whole thing is we tried to lower the premium. You have a set out-of-pocket that you're giving cash into your HSA. That's your money. You now have the ability to do the tax benefits of an HSA, giving you incentives to use lower-cost providers over higher-cost ones, cash incentives. There's a lot of really big positives, huge savings switching from American Fidelity to the new programs. A lot of big things, and I think when you use care in general, just like I said, nobody's making you change, but think differently. Ask that question, how much is this going to cost? Healthcare is the only thing that nobody knows what things are going to cost before it happens, right? So let's start over the next year, really start looking at how can we become better consumers, asking that one extra question that might save thousands and thousands of dollars to you and the company. So appreciate all your time. Hopefully this was a positive thing in general.
Hang on a second. So I'm just going to go one step further on that with American Fidelity because of the way that those plans are set up. On April 1st, the payroll deductions, so right now that's coming through your payroll for the payments. You do have the option if you, for some reason, really like that plan after you've met with one and you're just like, hey, I really want to keep it, or maybe I want to stack some benefits, you certainly can keep it. But what's going to happen is that American Fidelity is now going to invoice you directly, okay? If you decide that the colonial benefits are a better fit and you want to go with those plans, you are going to need to contact American Fidelity to cancel those because they're technically individual policies. Even though they flow through the company, they're treated like individuals. So we can't,
And
Markquart can't just,
They know what's in.
we'll work through that with you.